Hi, I'm Nicole Aaronson. I'm a pediatric otolaryngologist, also known as an ear, nose, and throat surgeon. I'm going to talk to you today about nosebleeds, also known as epistaxis. So nosebleeds commonly come from the anterior part of the nasal septum, which is the part in the middle of your nose. There's an area where a lot of blood vessels meet up, and this is called Kisselbach's plexus. So the typical pattern for most kids with nosebleeds is that they happen anywhere from a few times a week to once a week, and they can occur on either side of the nose. They typically stop in 5 to 10 minutes with pressure. One thing I always ask about is if the child has any bleeding disorders or if there's any history of bleeding disorders in the family. Another thing to consider is whether or not a child puts their finger in their nose a lot, as this can be a cause of nosebleeds as well. So the typical pattern of nosebleeds are typically something that kids grow out of as they get older, but in the meantime, they can be very annoying. They can sometimes happen at night when a child rolls over in bed and bumps their nose, and that can result in a lot of meshy sheets, or they can occur during school, and that can be very disruptive and sometimes result in the child being sent home. So there's how to manage the individual nosebleed and how to manage nosebleeds in general. So for the individual nosebleed, the best thing to do is to hold pressure on the soft part of the nose at the bottom. It's not so helpful to hold pressure up on the nasal bone, so you want to hold down low on the soft part. You want the child to tilt slightly forward. Tilting your head back only pushes the blood down the throat, which can cause the child to choke. So you lean forward and hold pressure and do that for about 5-10 minutes without peeking and checking to see if it's stopped. If there's a nosebleed that sort of continues to go on past 15 to 20 minutes, it's reasonable to use something called Afrin, which a lot of people use for congestion when they have a cold, but also works really well to constrict blood vessels. You can sometimes spray some of that on a tissue, place it in the nostril, and then hold pressure on that. For nosebleeds that are continuing past a half an hour and not stopping, it's reasonable to seek medical attention. But once you've controlled the nosebleed, when you're getting into that cycle of my child's getting nosebleeds every few days or multiple times a day, it's common that you'll come to see an ENT doctor. And so when I do see those kind of scabs or crusts or prominent vessels in the front of the nose, there's sort of two pathways for how I can treat them. So in the nose, blood vessels run right in the surface, which means that they're very subject to any digital trauma or rubbing or even dry air, and so they can bleed and a scab can form, and before that is completely healed over, then another bleed comes. And so the conservative things to treat them are really to moisturize the nose and to kind of improve its ability to heal. And so that can be using nasal saline spray or gel several times a day, and then something like a Vaseline or even an antibiotic ointment in the nose. Everybody has bacteria in their nose, and sometimes the presence of the bacteria can help things from healing over as nicely as they might otherwise. And so if you can cut down on that bacterial load, sometimes those kind of open, cracked areas can heal over better. So oftentimes I will give things like moisturization a try for several weeks to see how the patient does. If they continue to have difficulties, I'd move on to plan B, which is nasal cautery. Nasal cautery in kids is something that's done in the operating room. We always look with a camera on both sides of the nose to make sure there's nothing unusual going on, no masses, no other lesions that might explain the bleeding. And then we cauterize those prominent vessels in the front of the nose. The procedure itself is usually relatively short, and recovery is relatively easy afterward. We usually have the child avoid blowing their nose for a week or so, but otherwise they generally return to their normal activities. So, in summary, most nosebleeds are from the anterior part of the nasal septum, that Kisselbach's plexus. Most of them are brief and will stop with pressure. Nosebleeds that are concerning are potentially nosebleeds in children with bleeding disorders, nosebleeds that are always on one side, nosebleeds that are much longer lasting and don't respond to pressure. Conservative things like moisturization can be tried first for nosebleeds, and cautery can always be used when nosebleeds do not respond to the conservative measures. Thank you so much for listening. Please subscribe if you'd like to hear more of these videos to Dr. Nicole Knows. And if you have any topics you'd like to suggest, please put them in the comments. Thank you.